If you're on Medicare turning 65 this year, I need you to watch the next 10 minutes or so because there is one number buried in the 2026 Medicare changes that the insurance commercials are legally allowed to hide from you. And it could be the difference between a $200 doctor visit and a $9,850 nightmare. Every October, Medicare releases its new numbers for the coming year. Most people glance at their premium and move on. That's the mistake. In 2026, three things changed at the same time, and you need to understand all three together, not separately, to know which plan is actually saving you money. Change number one, Part B premiums are now $202.90 per month. That's the baseline everyone on Medicare pays, whether you have an original Medicare, a Medicare Supplement, or a Medicare Advantage plan. Change number two, Medicare has a $2,100 cap on what you pay out of pocket for covered drugs under Part D. If you are on expensive medications, this is genuinely significant, but we're going to come back to this a little bit later. Change number three, and this is the one the commercials skip. The maximum out-of-pocket limit on Medicare Advantage plans can be as high as $9,850 in 2026 in many markets. That number is the core of what we're talking about today. Medicare Advantage plans are marketed almost entirely on one number, the monthly premium, which is often $0 in many states. And I understand the appeal. Zero sounds a lot better than $150 a month. But here's what zero actually means. With Medicare Advantage, you're agreeing to pay your costs as they happen. Every doctor visit, every specialist, every hospital stay comes with a copay or coinsurance, and those costs are capped at the maximum out-of-pocket, which in 2026 can be as high as $9,850. Let me make that a bit clearer. Say you need a hip replacement. You're admitted to the hospital. In a typical Medicare Advantage plan, you might owe $400 to $500 per day for days 1 through 5 of your inpatient stay, then a different rate for days 6 and beyond. After surgery, you need outpatient rehab, which is more copays, then specialist follow-ups, more copays. A scenario like this can push you to or near that $9,850 ceiling in a single event. Here's the question you need to answer honestly. If a bill for $9,850 arrived today, would it hurt? For most people on a fixed income, the answer is a resounding yes. And if the answer is yes, then the zero premium plan is not actually the low-cost option. It's a deferred cost option. You're not avoiding the expense. You're just choosing when it hits you. Before we move to supplements, let's finish the Medicare Advantage conversation with the drug cap, because this is where some people on Advantage plans actually benefit. In 2026, your total out-of-pocket spending on covered Part D prescriptions is capped at $2,100. If you are on specialty medications, such as cancer drugs, biologics, certain diabetes medications that previously cost you $4,000, $5,000 or more per calendar year, this cap is meaningful protection. However, if your prescriptions are routine and already affordable, this cap does not change your math much. And the cap applies to Part D drug plans, whether you have a Medicare Advantage plan or a standalone Part D prescription drug plan paired with a Medicare Supplement. So it is not an Advantage exclusive benefit. Now let's talk about Medicare Supplement plans, also called Medigap. These work completely differently. You pay a monthly premium. In exchange, the plan picks up most or all of what Medicare doesn't cover. Your exposure is largely predictable. The two plans most worth your time in 2026 are Plan G and Plan N. Plan G is the most comprehensive supplement available to new Medicare beneficiaries today. You pay your monthly premium, you pay the $283 Part B deductible once per year, and after that, your costs for the covered services are effectively zero. Every specialist visit, every hospital stay, every outpatient procedure covered, as long as it's approved by Medicare. Plan G is predictability. If you see doctors frequently, if you have a chronic condition, if the idea of unexpected bills keeps you up at night, Plan G removes that variable. Plan N costs roughly $30 to $50 less per month than Plan G in most markets. Over a year, that's $360 to $600 back in your pocket. The trade-off is 2 copays, $20 when you see a doctor, $50 if you go to the emergency room and are not admitted. Plan N also does not cover what are called Part B excess charges. If a doctor does not accept Medicare assignment, they can charge up to 15% more than Medicare's approved amount, and Plan N leaves that cost to you. In most states and with most providers, excess charges are rare or banned entirely, but you need to know it is a gap. Here's the honest break-even math. If Plan N saves you $50 a month or $600 a year, and you see the doctor 10 times, your copays are $200. You are $400 ahead still. If you see the doctor 20 times, your copays are $400. You're still $200 ahead. For Plan G to be the better financial choice on premium alone, you would need to hit a scenario where excess charges apply or your ER visits become frequent enough to close that gap. For a relatively healthy senior, Plan N wins the annual cost comparison most years in many markets. The risk with Plan N is not a single bad year, because even then, both Plan N and Plan G supplement plans have no maximum out-of-pocket ceiling to fear the way you do with a Medicare Advantage plan. The risk is if your health does change and you want to switch to Plan G later, depending on your state, you may have to answer health questions to change plans. If you go with Plan N, go in knowing you may have to stay there. So how do you choose? I'm going to give you the honest decision framework. If your priority is the absolute lowest total annual spend and you are in good health, Plan N is worth a hard look. If your priority is no surprises, no copays, and you see specialists regularly, Plan G is the cleaner answer and worth the extra premium. If cash flow is generally tight and you cannot afford any monthly supplement premium and you have savings you could draw on in a bad year, Medicare Advantage may be a reasonable short-term choice, but go in with your eyes open about the maximum out of pocket. What I would caution against is making this decision based on a TV commercial, a mailer, or what your neighbor did. These plans are standardized by the federal government. A Plan G from one company covers exactly the same thing as Plan G from another company. What is not standardized, though, is the price. The same Plan N can be $40 or $50 cheaper per month just by choosing a different carrier in the same zip code. That difference compounds over years. Here's what I want you to do right now before we close this video. If you are within 6 months of turning 65, or you are already on Medicare and have not reviewed your plan since 2024, pull up your current plan documents and find out your maximum out-of-pocket number. If that number is above $5,000 and a bill that size would be a real problem, you owe it to yourself to at least find out how we can help close that financial gap with a complimentary plan, or compare what a Medicare Supplement plan would cost you. Our team runs these comparisons every day at no cost to you. We will pull the actual 2026 rates for your zip code, show you Plan G and Plan N side by side, and tell you what your real break-even number looks like. There's no sales pressure. If Medicare Advantage is still the right fit for you, we will tell you that too. Call the number on the screen today, because 5 minutes a day could save you thousands over the years.